In this presentation, we will be looking at the multi-implant post system used in conjunction with Osteo-T implants. The abutment is screw retained and self-locking. What are the main features of the abutment? Well, the first thing to note is that one abutment fits all sizes of anchor lock implants, regardless of their dimensions, that's diameter or length. The abutments are platform switch, and this applies again to all diameters of implants, regardless of their diameter. There's a friction lock incorporated at the implant abutment interface, which means that the probability of abutment loosening during function is very much more reduced, and it also produces a hermetic seal, which in conjunction with the platform switching feature helps minimize crestal bone loss. These abutments should normally be tightened to only 40 Newton centimeters unless you are experiencing unusually high frequencies of abutment loosening. The abutment comes in 6 vertical angular corrections and 12 horizontal offset corrections. And the abutment has been designed to be able to be modified by the laboratory within limitations. The multi-implant post is available in 6 vertical angular corrections, starting from 0 all the way up to 25 degrees in 5-degree increments. This maximizes the choice and availability of abutments to your laboratory to be able to correct angled implants. Now let's look at the implant abutment interface in a little bit more detail. The first thing to note is just above the connection, the hex connection, is a very slight taper. This taper engages with the taper in the implant, and when the abutment has been tightened to 40 Newton centimeters, it will be virtually impossible to remove due to the cold welding that will occur at the taper. So it is very important that clinicians do not tighten the abutment until they are absolutely sure it is in the right place and they wish to proceed. There is a separate tool that is available to help remove the abutment, which we'll discuss in another presentation. The other important feature with this abutment is that unlike other abutments, it does not come with a 6-sided hex but a dodecadon which has 12 sides. This allows for almost infinite horizontal positioning of the abutment, but at the same time providing indexing and stability. Finally, this abutment has been designed to be used with our gold new high torque screw and should not be used with the older low profile screws. Usually in function, tightening this screw to 40 Newton centimeters will be sufficient to ensure the abutment does not come loose during function. However, if you're experiencing unusually high levels of abutment loosening because of the patient's occlusion, then it may be tightened to 60 Newton centimeters, as this is well within the fracture tolerance of the components and the screw.